Hi friends, welcome to our channel Global Health Helpline. Now, we are going to learn about a homeopathic medicine Helleborus Niger from the book Lectures on Homeopathic Meteria Medica by James Tyler Kent. Please like the video and press the red subscribe button and then bell icon for next updates. Let's begin. Brain and mind. In all the complaints of Helleborus, stupefaction occurs in greater or less degree. Sometimes it is a complete stupor, sometimes a partial stupor, but it is always stupefaction and sluggishness. Hellebore is useful in affections of the brain, spinal cord, the general nervous system and mind, but especially in acute inflammatory diseases of the brain and spinal cord and their membranes, and in troubles bordering on insanity. There is a peculiar kind of imbecility or stupefaction of the body and mind. The extreme state is unconsciousness. Complete unconsciousness in connection with cerebral congestion or inflammation which has gone on to hydrocephalus, cerebrospinal meningitis, or inflammation of the brain, with stupefaction. Even early in the disease Hellebore lacks the wildness, and acute delirium found is stramonium and belladonna. It is passive. Again, it fits in after the wildness of the delirium has passed away and the patient has settled down into a state of stupefaction. The patient lies upon the back, eyes partly open, rolling the head, mouth open, tongue dry, eyes lusterless, staring into space. Staring at the individual talking. Waiting a long time to answer, or not answering at all. Violent attacks of brain trouble frequently come to a sudden end, but those that are more passive linger, and that is where Hellebore comes in. The Hellebore case will linger for weeks and sometimes months in this state of stupefaction, gradually emaciating. He lies upon the back with the limbs drawn up. He looks pale and sickly. When questioned he answers slowly. The text says, stupefaction bordering on insensibility. Another common expression is diminished power of the mind over the body. The muscles will not act, they will not obey the will. It is a sort of paralytic state, but stupefaction expresses it. Cannot project ideas, cannot rivet the attention, cannot concentrate the mind. The patient appears semi-idiotic. Delirium is not common, and when present it is muttering. There is more stupefaction, more do nothing, more say nothing than delirium. Yet there is evidently confusion of mind, he cannot think. In many instances, very late in the disease, the patient can be roused up, and he will act as if he were attempting to think, as if he were attempting to answer, attempting to move. But he simply stares at the doctor with eyes partly open, with a dazed expression on his face, and picks his finger ends. When questioned, the Hellebore patient is not able to tell you what he has in mind unless considerably aroused and agitated. But when so aroused, he will talk about spirits, or say that he sees devils. He sees in his imagination those images that he has read about, or seen pictured, as the devil, with horns and a tail. A young person who has never heard of the devil, or of spirits, would not have that form of hallucination in his delirium. The hallucinations are shaped in accordance with what he has been taught to imagine. Hellebore has a peculiar quasi-hysterical condition, a form of insanity. She imagines she has sinned away her day of grace. Like Oram, she believes that she is doing wrong, that she is committing an unpardonable sin. That is as near as the remedy approaches to insanity. An old woman having been accused of theft by the women around took it so much to heart that she hanged herself. This suicide produced such an effect on the women of the village that one after another accused herself of having caused the death of the old woman. Thanks for watching full video.
Click on the link to watch the other parts of Helleborus Niger and don't forget to subscribe the channel.